My name is Michael Cornett. A few more nibbles from the whole tooth. Just to introduce myself real quick, I work for the Northeast Regional Board of Dental Examiners, also known as NERB. Yes. We run the exams that dentists and dental hygienists have to pass in order to be licensed. Our jurisdiction runs from DC, Maryland, and West Virginia along the East Coast to Maine, as far west as Michigan and Wisconsin. We have a couple standalone states like Oregon and Nevada. Go figure that out. There are 4 testing agencies in the United States. Every now and then there's a baby step taken toward a national clinical exam, but you know how these things go. I work largely in registrations. I am not a dental professional, but I have absorbed much information about dentistry in my time working there, about 10 years. So any information here will be the results of my own research. Any opinions expressed are my own. I am not speaking as an official representative of my organization. That's your disclaimer. Recently, the podcast Point of Inquiry ran an episode, The Tooth About Dentistry, which, if you haven't heard it, please do. It's a wonderful overview of dentistry from a skeptical scientific viewpoint. Great consumer information. I would recommend it to everyone trying to find a dentist and anyone getting dental treatment because it's just good basic information. But this talk is my own sequel to that, delving a little deeper and casting a skeptical eye on a few aspects of the dental industry. And one big thing that I see a lot of are over-the-counter dental products. All around us, we are given messages about having white teeth. The dental aisle of the grocery store and the drugstore, they're always overflowing with toothpastes and mouthwashes and strips and everything else that promise to whiten your teeth. And I've talked to people, this has permeated our culture to the point where having slightly discolored teeth is a personal failing. You drink too much coffee, you smoke too much, you're not brushing enough. And it's just nuts. And people are encouraged regularly to get their teeth whitened. Well, tooth whitening, or dental bleaching, as it's technically known, there are several methods. They usually involve an oxidizing agent of some sort being put on your teeth. There are 2 major methods of that. High concentration bleaching, normally done in the office or at home with the gels and little trays that fit over your teeth. The gel usually contains carbamide peroxide or even hydrogen peroxide. And it sounds icky, but it's usually pretty effective. Low concentration bleaching uses the over-counter strips that you get at the drugstore. They're low concentration. It could be a week or more before you see any results, if any. Sometimes they are ineffective. Also, interestingly, some treatments make your teeth more reflective, so they're actually shinier. And they look fake. An observation I heard about some of these dental whitening treatments is you're spending a lot of money to have teeth that look like dentures. Another technique which must be done in dental offices is to smear a gel in the teeth and apply light to it. The use of that has been disputed. In past studies have found that the light treatment has little to no effect, although since then there have been new treatments. They might have more effectiveness. Some techniques use UV light. Not good for your skin or eyes, so be careful with that. But a reality of dental bleaching is that not all stains respond to the bleaching, and results vary not only with the product used, but with the individual. A product that works really well on you, you might smear something in your teeth and they're blindingly white a few days later, will be absolutely ineffective on you. Go figure. Dental bleaching also carries risks. High concentration gels that they use in the office can cause chemical burns on the soft tissues of the mouth and leave your teeth permanently sensitive. There are also reports of increased risk of tongue cancer connected to the use of high concentration gels. Not sure about the science behind that. Lower concentration home treatments are frequently misused because you're doing them at home and you don't always follow the directions. And they can erode tooth enamel. A big problem is that with most over-the-counter home treatments, you have to use them for a long time to get any noticeable results. And then you have to keep on using them regularly to maintain the color. A 2005 study of in-office high-concentration whitening found frequent loss of whiteness within 7 days of treatment. And even the most professional and effective whitening, you still have to go back to the dentist regularly to maintain it. About the only way to permanently have perfect white teeth is to have veneers or dentures. And some dentists are known to pressure patients to have their teeth whitened. I had a problem with a dentist I used to go to who pressured me over and over to have my teeth whitened, and finally I just said, I'm taking my business elsewhere. I'm sick of this shit. Tooth whitening is not covered on most dental insurance plans. I don't want to say any because there might be one out there that I don't know about. To the best of my knowledge, there are none. It can be an expensive process. I saw a price quoted recently of a treatment costing $750. And it doesn't always work. And a reality that many people don't realize is tooth yellowing is natural. It is a natural part of aging. Children, when they have their first teeth, what they call deciduous teeth, just like the trees, they fall out, their teeth are blindingly white, but the adult teeth, they tend to get yellow over time as part of mineral changes in the enamel. And yes, smoking, coffee, tea, and red wine do have something to do with it. But for many people, even if you avoid things like that, and you brush and you floss and you do everything right, they're still going to get yellow. It is just part of aging. And there isn't a lot of research, but from people I've talked to, there is a prevailing opinion in the dental community that it is at least partly genetic. And I have been told of one ongoing research project looking at a possible connection with having red hair and yellow teeth, which would not surprise me given some of my relatives. And most dentists, if they encounter a person of mature years who has perfect white teeth, automatically assume dentures or veneers, or that you've had a lot of work done. Being a person my age who has blindingly white teeth is not considered natural. So my personal view is if you're better off accepting your teeth for the color they are, unless you're in a profession like modeling or acting and that's part of your image, or if your teeth are really badly discolored and it's really undermining your self-esteem. Tooth whitening, dental bleaching, is a valid option for those who want to seek it, but it is not without risks, not always effective, and definitely a drain on the wallet. And then noting that many home tooth whitening treatments tend to erode tooth enamel, it's amusing to see very new mouthwashes on the market claiming to rebuild enamel. It's as if an expensive product they market has caused a problem. And as a result, there's a new expensive product to help solve the problem created by the first product. And the promise of rebuilding enamel, I can see this happening. Someone's going to see a rebuilt enamel, it's going to heal over my cavities. I can see that happening. And that is just not possible. How effective are these mouthwashes? Unfortunately, they're extremely new. Not a whole lot of research has been done. But it has been noted that any effect on your teeth is likely to be minimal, because you're talking about something that is only swished around in your mouth for about 20 to 30 seconds, maybe once or twice a day. That's not a whole lot of time for something to have an effect on your teeth. Your mouth does have a natural mineral enamel rebuilding solution, and that's called your saliva. Saliva is important in restoring tooth enamel and protecting your teeth. This has been found in people who lose their salivary glands, which has happened. If you have radiation treatments on your head and neck as part of cancer therapy, it can kill your salivary glands. And people that happens to will suddenly find they're getting cavities and dental problems like crazy. So there's all sorts of medical treatments for that. And people who also generally have dry mouths also tend to have dental problems, to which we just recommend chew some sugar-free gum that'll help build up the saliva and protect your mouth, unless your dentist recommends something else. And mouthwashes are a good part of dental hygiene, but you seldom need more than just a basic antiseptic, Listerine scope, something like that. There is a lot of shadiness out there with mouthwashes. There's one called Plax, which is still on the market. When it first came out, Plax claimed to wash away plaque and leave your teeth feeling smooth and clean. And I remember the commercials with the girl going, Plaques contained glycerin. That smooth and clean feeling was the glycerin coating your teeth. So Plaques did clean up their act. They removed the glycerin from the formula. They took the ads off the air. They're still on the market. But I've seen quite a few mouthwashes come and go. They make all sorts of lofty claims about protecting your teeth. They don't always work out. So when you're buying over-the-counter stuff, it is best to stick to the basics and not to waste a lot of money on stuff with big claims. Get a good basic toothpaste, a good basic toothbrush, and a good basic mouthwash. You should be fine unless your dental professional recommends something else. Okay, moving on. I will give a quick mention to something that is used by alternative dentists, who sometimes refer to themselves as biological dentists, whatever that means. It makes me think that they must believe that regular dentists work on robots. And this is when you have root canal therapy, which is something that a lot of people dread. It's happened to me. It's really not all that bad because anesthesiology, great. When you have a root canal and they're working on a bad tooth, they actually remove the nerve from the tooth. Dentists and endodontists are dental professionals who focus on this. They commonly fill up the space left by the nerve with a material called gutta percha, which is a natural latex from a tropical tree. It is biologically inert. It has no effect on you whatsoever. It's been used for over a century and has been proven to be an effective and safe tool. However, in the 50s, a new material called Sargenti paste was developed and is used sometimes by biological dentists. Sargenti paste is mixed up. It contains paraformaldehyde, and when injected into the root area, it turns into formaldehyde, killing off any bacteria or infection in the root. And to be honest, the vast majority of cases when it's been used, there are no ill effects. So I will be fair about that. However, even the most experienced endodontist can overfill. It happens. If they overfill with gutta percha, it just pokes out a little bit, it's biologically inert, no ill effects. Sargenti paste, the formaldehyde gets into your tissues, and on your bones. It can result in permanent, painful, and sometimes disfiguring problems. What'stheharm.net, if you go to that, in their section on alternative dentistry has quite a number of stories of medical and dental problems that resulted from the use of Sargenti paste. It is not illegal to use. I do believe it is illegal to ship over state lines. There's nothing stopping you from mixing it up yourself. And the American Association of Endodontists has labeled Sargenti therapy as unsafe and substandard. And it is not taught in American dental schools. I have heard gossip that I believe it's called A.T. Sill University, which is an osteopathic school, are now offering dental degrees, and they might be teaching this, I'm not sure. Although the idea of a dentist coming from an osteopathic school makes me wonder. So if you're ever going to have a root canal, talk to your endodontist and the dentist about what they'll use. 99.9% of the time they're going to say gutta percha, but you better be safe than sorry. So finally, I want to address a growing issue in the dental community, and that is greater integration between dentistry and internal medicine. It is known that various medications can affect your dental health. A common example is tetracycline, which is an antibiotic. If you give it to a child, their adult teeth come in discolored. And we're talking anywhere from a mild yellow to orange or even brown. It's ugly, but it's not a big problem. However, it can be a problem on your self-esteem and everything else. And now it is not prescribed for anyone under the age of 8. And in olden days, back in the 1800s, in match factories, there used to be a problem called phossy jaw. And this was found in factories that used white phosphorus. And it was basically a case of an overexposure of phosphorus, which tends to hit your lower jaw first and foremost. Apparently, your lower jaw is very susceptible to phosphorus. Oh. Your lower jaw is very, very vulnerable to a phosphorus overexposure. And basically, it causes the bone cells in your lower jaw to die. It is known as osteonecrosis of the jaw. The bone cells in your jaw die. They will no longer grow or knit when broken. It usually leads to severe infections, toothaches, swelling of the gums, bones glowing in the dark. This is phosphorus after all. Brain damage, loss of the lower jaw, and death from organ failure. White phosphorus was banned in industry by the Berne Convention of 1906, thank goodness. However, starting about 6 or 7 years ago, they started seeing similar problems cropping up. A number of oral surgeons started submitting papers to various journals that they were observing this happening. It turns out that there's been an upswing of use of bisphosphonate medications, and these are commonly used as parts of chemotherapy for cancer. Also, osteoporosis medications like Boniva are bisphosphonates. And apparently, all this bisphosphonates is creating a new swing of osteonecrosis of the jaw. It has been found, the vast majority who have taken bisphosphonates, again, this is like Sargenti paste. To be fair, the vast majority of the time, there's no ill effects. However, when there's a problem, it's nasty. The results are reason enough to be cautious when dealing with bisphosphonates. When you have osteonecrosis of the jaw and you have a tooth extracted, the hole does not heal over. And I've seen photos, and this is why you'll thank me, I don't have slides. I was asked, do you have slides? I said, people will be screaming and running from the room. No, I'm not going to have slides. Implants become impossible. Gum tissue degrades and withdraws from the bone. Lesions develop both in the mouth and on your face. Heaven forbid your jaw breaks. Lots of surgery is required. Although it does primarily focus on those who have taken bisphosphonates intravenously, much less so on those who take them orally. It's still little understood. Treatment options are limited. And still a lot of research being done. And this was something that dentists were noticing for several years and are only now succeeding in bringing to the attention of the medical community at large. And also to the pharmacological industry. Within the last year, I've noticed ads for osteoporosis drugs are now mentioning dental problems or jaw problems in that long list of possible side effects. There's now a growing call for doctors and dentists to work together whenever bisphosphonates are concerned, especially with cancer patients. I know for our exams, we use live patients when we have dental students do cleanings and tooth fillings on live patients. And we always tell them, don't bring in anyone using bisphosphonates. And that's safety and liability reasons. And there's also a big question about what other phosphates are a problem. Phosphorus is necessary for life. Phosphorus is an essential ingredient of your tooth enamel. But like so many other things, too much is bad. Phosphorus is present in lots of processed foods. Actually, I was looking at the bottle of soda that I drank. The third ingredient after water, carbonated water and caramel coloring, is phosphoric acid. And just about every toothpaste has phosphorus in it to one degree or another. I actually stood in the dental aisle of my grocery store looking at the ingredients of every toothpaste, trying to find something that did not have phosphorus. And it was difficult. There are a few out there. But there is a lot of uncertainty as to whether or not how much phosphorus is too much, and whether it's one kind of phosphorus or another. It is still ongoing research. That is just one way in which there needs to be greater integration between the two disciplines. Quite often, especially with some of the doctors I've had, they don't take too much interest in what's going on between you and your dentist. And quite often my dentist isn't interested in what's going on between me and my doctor. Sometimes I have to talk to them about that. It is known that, and commonly known, that abscessed tooth can kill you. It can transmit infections to your heart or your brain. A young boy locally died from a tooth abscess that traveled to his brain a few years ago. There is a growing opinion that oral health can influence your overall health. There was a recent study at Bristol University that proposed that streptococcus, a bacteria that is responsible for tooth decay, also caused clots when introduced to the bloodstream and could be responsible for heart attacks. So brushing your teeth saves your life. Of course, it does kind of make sense because if you have bleeding gums from gum disease, that is a gateway for bacteria to enter the bloodstream. And there's a lot of anecdotal evidence of health being improved by dental care. Not a whole lot of research, unfortunately. To give a personal story, I had a tooth, upper molar in the back, that was one problem after another for years. Finally had the thing extracted a couple of years ago. I really feel like my health improved quite a bit, although I am unsure of how much of that was just relief over getting the damn thing out once and for all, and also just a reduction of stress of dealing with that thing. And of course, reducing stress, good for your health. But there is a lot of research being done, lots of new stuff on the horizon. Implant technology, for instance, is improving and becoming cheaper, and there are rumblings about endodontology becoming an endangered science now, because instead of trying to save the teeth, they'll just take them out and implant new ones. Every so often there's talk of teeth being grown from stem cells. Working on mice, I think. I don't know if they've done it with humans yet. Every so often there's talk of new techniques for filling cavities or making crowns. Maybe they'll even work in some nanotechnology. But there's still a lot that isn't known. And until then, find a dentist you can trust and talk to them. Taking care of your teeth isn't just about looks. It really should be thought of as taking care of your overall health. And don't sacrifice your overall health for looks. So that's all I have to say. Any questions?
What would be a biological dentist's rationale for choosing the Sargenti paste over the whatever the other stuff is called?
What would a biological dentist's rationale for Sargenti paste? Sargenti paste is cheaper. It is also, the irony, I meant to say this earlier, the irony struck me that this is a case when you have something that's natural and has been used for generation after generation and is still the preferred treatment over something that came up more recently. But just a lot of it is a rejection of the dental mainstream. So, anyone else?
I have my entire focus almost on skepticism is about alternative medicine. So I'm interested in this idea of alternative dentistry. When did this arise? When did this become popular? Is this in conjunction with naturopaths and osteopaths? Is this?
That's not something I really looked into. Like, I did not look into the overall history of alternative dentistry. Maybe that's something I could do next year. But I know I've thought about, I hear some of the folks in our organization grumbling about some of these quack dentists, and I keep thinking one of these days I should just strap on the brass ones and go in and have them look me over and listen to them talk. Not let them treat me anyway. But maybe IIG could like back me up on that.
Well, what is the attraction? I mean, in terms of making their pitch. You know, I suppose it's more commonly known for people who know what a chiropractic is, for example. But what would be an attraction, the draw of alternative dentistry?
I think just throwing in the word alternative, I think draws a lot of people. A lot of people who are not happy with how things are done in their usual dental office, and they want to try to find something different. And I think a lot of people, when they start dealing with a lot of naturopathy and all that, will look for alternative anything. You know, alternative. A rejection of Western medicine, but standard run-of-the-mill medicine, even though that might be the best way to go. Let's see, who was next? I think you were.
Is there any regulation over the claims which can be made by dental products, aside from, curing cancer?
I don't know much about the regulatory outwards. I think a lot of it is looked into, and kind of like plaques when they were dealing with all the it makes your teeth so smooth. And finally, it took a little while for people to analyze it and realize the smoothness was the glycerin. So I think it's about as soon as they can do the research and see what really is the effect of it, that they can do that.
I had talked sometime in the past about how much woo there is in dentistry and how a lot of stuff has not been well-studied stuff. Recently, I was told by my son, when I told him to brush his teeth after eating, whatever, that he read a study that said that brushing your teeth right after eating, like we've been told since we were kids, is not a great idea, because after eating, your enamel is softened or whatever from foods and things that you've eaten, so you actually can do damage by brushing too soon after eating.
I did hear about that. I did ask a couple of our folks in my organization about that. They'd heard anything about that, and they were very skeptical of that claim.
I would think if it's something really acidic, that might make sense. But
if you're eating spaghetti with tomato sauce and drinking orange juice and having lemon meringue pie for dessert, that might have something to do with it.
3 times a day.
I wonder if maybe some of the mercury scaremongering spillover might contribute to?
The mercury scares might have something to do with it. I have heard something about how mercury is used in the metal amalgam fillings, which are actually cheaper and more permanent than the white plastic ones. They're just ugly, but you might as well stick with the amalgams if you want. And actually, amalgams do have a small amount of mercury, and I've been told that there is a theory that the mercury in the amalgams helps kill off the cavity-producing bacteria. And I think a lot of it is, there are lots of stories on what's the harm about people who have their amalgam fillings yanked out and undergo chelation therapy and are told, oh, the mercury in your system went up. But it's dreadful. But I mean, the amount of mercury in amalgam fillings is tiny. So, are we out of time yet, or do we have a?
I want to do alternative dentists typically or almost always market themselves as such, or is there a risk if you're in the market for a new dentist that you end up with someone who's not doing science-based dentistry? And if so, what questions would you ask?
What questions would you ask? I would recommend looking at where they went to school. I think that is right up there. Google the place, find out if it's a legit dental school. The ADA.org has a listing of approved dental schools, so you can see where they went from that. Also, most state dental boards have websites where they list any disciplinary actions taken against dentists. I know DC and Maryland did not. They might have. New York's is exhaustive. I've looked for quite a few people on there. So that's also a good resource. But again, also just bluntly asking them flat out. I mean, when you do a root canal, do you use gutta percha, you know? Or they bring up this, the Sargenti paste. It's like, bye, see you later. I've also heard stories of dentists who claim that, the ghost of your mother is in this room and she's watching over you. That's a story off What's the Harm. That's a story off what'stheharm.net. Scary. But I think the woman whose dentist said your mother's ghost is in the room actually got up and left.
What about the natural toothpaste and things like that that have been exploding?
The natural toothpaste, well, a lot of them do stick to a lot of basic essential stuff, so they're really not all that bad for you. The problem is so many of the commercial toothpastes are really overloaded with tooth whitening, which doesn't do a whole lot of good. I've taken to using, just to do a little quick, an Arm & Hammer Complete Care, which does not contain phosphorus. I know it's a tiny, tiny, tiny possibility, but I got glaucoma from using a steroid-based nasal spray, which happens to about 1 in 10,000 people. So I've been really paranoid of those 1 in 10,000 reactions ever since. But they are out there. They're not, I think the established ones, I think Tom's of Maine actually is actually a decent toothpaste to use, even though they're expensive. And you're paying more for less ingredients, which makes no sense to me. But there's a lot of alternative stuff out there. I would say look for stuff that's been around for a while and is an established brand. So, okay, we're done. Thank you very much.